Hi, today I'm going to talk about what happens in our body during trauma and explain why you might react in ways that does not make sense to you. I will also give you tools so you can continue to create your own trauma toolbox. First, I want you to know that we do not choose our reactions. Our body makes those decisions for us. It wants to protect us as much as possible, but also as fast as possible. In order to do so, it hijacks our logical brain and goes into fight, flight, freeze response automatically and involuntarily within seconds. What is a fight, flight, freeze response? Let me clarify. Have you ever watched the snowman prank YouTube video? If not, there's a link below if you haven't. Anyway, that video shows a person in a snowman costume who surprises pedestrians that are walking by. And what you see is that some people react to the snowman prank by jumping or running, which is a flight response, and others go into fight response by saying, I'm going to punch you, or by just raising or showing their fists. And then there are those that just stand still and freeze, maybe even fall on the floor. You don't have time to think because thinking is too slow, and our body needs protection immediately. So even though the snowman is obviously not dangerous, we see that people still react with a fight, flight, freeze response. Only when our body realizes that we are safe, we start to relax again. But if we are in a traumatic situation, we are too overwhelmed and frightened to cope, our body might not relax and instead might stay in survival mode. Let me tell you what happens when we are in this mode. Our nervous system that is responsible for our fight, flight, freeze, survival mode response, called the sympathetic nervous system, is in charge now. It tells our body to take all the energy out of our stomach and other areas where it is not needed, to direct it to areas where it is needed the most. When we are in fight, flight, freeze mode, our logical mind is not in charge, as I said. It's not on the forefront anymore. And as a result, we end up not being able to focus, have trouble remembering, and feel easily overwhelmed and anxious. Blood is directed to our muscles in our legs and arms to run and fight. A hormone called adrenaline will help us to enhance endurance and strength, and cortisol will reduce our pain. Since our heart needs more oxygen, our heartbeat starts to go faster. So if we get stuck in this survival mode and our body chronically diverts blood into our limbs, releases hormones, and uses up anything it can to mobilize us, guess what happens? We might experience hormone dysfunctions, which can cause depression and anxiety. Our adrenal glands can tire out, and we might end up with adrenal fatigue, causing us to be tired in the morning, even if you had enough sleep. We also might end up with stomach and skin issues because the energy is constantly taken out of those areas. We might experience constipation, heartburn, and ulcers, and other stomach issues. Even our stomach lining can become damaged and might cause something called a leaky gut, in which bacteria and toxic waste can enter in our bloodstream, which can cause inflammation. This inflammation and constriction of muscles might lead to unexplainable pain and chronic illnesses. I see that all the time in my private practice. James Gordon, the author of Transforming Trauma, he wrote about it. He wrote in his book that our body needs support and needs to refill our reservoir. So therefore, what we eat and certain supplements become very important. You can go, of course, you can go to a nutritionist to help you with this. You can also read James Gordon's book or research articles on your own, whatever you like. But it is important to attend to your body. In addition to your diet, you can help to support your body by calming down your nervous system. And how do you do that? Well, one way, according to Stephen Porges, a scientist and psychiatry professor, is to activate a nerve that goes from all the way to your face, all the way to your gut. And this nerve is called the vagus nerve. And this nerve is part of the parasympathetic nervous system that causes relaxation. And it can help you to move out of survival mode and into the relaxed mode. We can stimulate this vagus nerve by humming, singing, gargling, facial exercises such as face yoga, cold water on your face, gently massaging your face and neck and earlobes, sleeping on your right side, aromatherapy, chewing gum, acupuncture, and so on. So maybe make it a habit to hum, perhaps in the car, in the shower, when you walk, or anywhere else. Gargle after you brush your teeth, massage your face when you put on your lotion or your sun lotion, make funny faces, and try to do breathing exercises. What if you have trauma around breathing? For example, if you were on a ventilator due to COVID or you had pneumonia, breathing techniques might trigger you instead of helping you. So if breathing does not trigger you, take a deep breath in and out. If it does, try the other vagus nerve exercises. Signs of a low vagal tone can be having trouble with your voice, pain in your ears or neck, spilling or gagging easily when you drink, irregular heartbeat, and more. If you strengthen the vagus nerve, you increase the vagal tone, which can improve your mood, such as depression and anxiety. It can improve your trauma symptoms, digestion, and overall health, and you can become more resilient to stress as well. Please be mindful of these exercises if you're stuck in freeze mode. Activating the vagus nerve might cause you also to faint or trigger other reactions. So try it out for a little bit and see how you react. Remember to subscribe and hit the notification button so you will be able to keep adding tools to your trauma toolbox. And I will see you next time. Bye-bye.